Hello and welcome to Matters That Matter. The video about blood sampling has been divided into two, hence the procedure will be in the video that follows. Hello and welcome to Matters That Matter. Today we'll be looking at the containers that are used for venous blood collection and the order of draw. Here are the most commonly used containers. Amongst them you have the light blue, the red, the yellow, the green, purple, pink and grey. Note that the color of the top of the tubes is not always uniform, and therefore there might be some variation. We might look at some of the variations, but I won't be able to go through all of them. Hence, let us start with understanding what do each container contain, and also where to send them and what are the tests that are carried out. So as to ease the purpose of remembering the tubes, I'll just go by the commonest first, and then in the next slide we'll go by the order. The table here has the proper order in which you have to take the sample. So let us first look at the commonest tubes that are used. The one that is a favorite amongst most students is the purple one, because it's the easiest according to me. It contains EDTA, it is for hematology. Full blood count can be done on it, and in that you can note the level of any type of infection. You can know about the ESR, the hemoglobin, the hematocrit level. Besides that, the second commonest is the golden yellow, that contains silica and serum separating gel. It is used in biochemistry mostly for UNE, and also some of the liver tests such as SGOT, SGPT, CRP, bone profile, in that you would check for calcium, magnesium and phosphate, albumin, lipid, TFT, PSA. Following the order, the third commonest in this list would be the red one, that is containing no anticoagulant, and it is sent to either the biochemistry or the blood bank. It is used for lipid profile, HIV, PCM, phenytoin, blood grouping and cross-matching. The grey tube contains sodium fluoride or potassium oxalate, and it is used to check for the fasting glucose and as well as lactate level. Sodium fluoride prevents glycolysis. As far as lactate is concerned, it is increased if ever there is tissue hypoperfusion, and this is seen in sepsis and acute ischemia. Next on the list is light blue, which contains sodium citrate, and it is used for coagulation profile, that is PT, ABTT, fibrinogen, INR, D-dimer. So you can use it to even monitor warfarin by checking the INR, or to look for DVT and PE. Finally, we have a bit of a lot less commonly used tube, that is the pink tube, which contains K2 EDTA, and it is for blood grouping and cross-matching only. But the order of taking the blood sample is also very important, and that is what is known as the order of draw. In this, I would start by explaining the little mnemonic and then going by the color. The mnemonic is as follows: stop light, red stay, put green, power, light go. So what does this mean? You're at the traffic light. As soon as you see that the light is red, you would need to stop. So stop when the light is red, stay put. Then when the color is green, so that gives you power to, it is the power light to go. If you have easier mnemonics, please drop down in the comment section, but that is the one that's the most popular on YouTube. Now, what does the stop mean? It is for the sterile one, that is the blood culture bottles, which I haven't added in the order of draw here because we are looking only at the blood sampling tubes. But if ever you're going to take blood culture, remember that you need to draw the aerobic first, that is the green color. That's why stop is in two colors. So the green color first, and then the anaerobic, that is the red color, next. Now let us look at the tubes. So as I told you, the light blue contains sodium citrate, and the next one is the red one. It has no anticoagulant. The golden yellow, tiger turbs, red, grey, That one is the silica and serum separating gel, that is the SSD. The light green is the plasma separator tube with fibrinogen. And then you have the green one, that is the heparin. Purple is for ETTA. K2 ETTA is present in the pink, and the grey one contains sodium chloride or potassium oxalate. So the order of draw would be, as I told you first, the stop is for the sterile culture bottles. Now let us look. Light is for light blue, red is for red, stay is for SSD, put is for PSD, the green stays for the green tube that contains heparin, then the power is for purple, the light is for pink, and the go is for grey. So that is the order. Here you can see in the table I have also added the number of times you need to invert the tubes once the sample has been taken. Please make sure not to shake the tubes, as that might cause hemolysis. So this is it about the order of draw. For the next video we'll be looking at the procedure for blood sampling, that is the venipuncture. Thank you for listening. Till next time, this was Matters That Matter.